Welcome back to our series on pharmacology. This will be our last video in our course. In this video we'll discuss chapter number 25, Emergency Drugs, Intravenous Fluids, and Blood Products. Learning objectives for this chapter: describe several routes of administering emergency drugs, describe the various types of drugs given during emergency resuscitation and their therapeutic effects, compare and contrast the site of action and therapeutic effect of various drugs used to treat a drug overdose, a suicide attempt with a drug, or an accidental drug poisoning. Describe the physiology of anaphylaxis and how drugs are used to treat it. Describe the various ways in which intravenous fluids are administered. Name several types of intravenous fluids. Name several types of blood and blood products. And lastly, compare and contrast the therapeutic effect of blood and blood products with that of plasma and plasma products. First, we'll start off with an introduction. There are some types of emergencies that are life-threatening and that require an immediate drug intervention. And these include cardiac arrest or respiratory arrest, shock from trauma or infection, anaphylaxis, and drug overdose. Now, unless those conditions are corrected quickly, several things can happen to the body within minutes. That could include oxygen levels in the blood decreasing, carbon dioxide and lactic acid levels in the blood increasing, the blood pH becoming more acidic, cellular metabolism in the vital organs will slowly come to a halt, and eventually the patient can die. All right, now we'll talk about basic life support. It's also known as CPR, cardiopulmonary resuscitation. This is the mechanically circulating the blood through the body, and also inflating the lungs with air. Now a step beyond that is advanced cardiac life support, or ACLS. Now this includes the use of drug therapy. And what's common for this type of therapy is the crash cart. And this is a cart that's wheeled from room to room that contains all the necessary emergency drugs and resuscitative equipment needed. And this is available in hospitals, doctors' offices, clinics, and other healthcare facilities. All right, now we'll talk about routes of administration for emergency drugs. Now, routes to administer emergency drugs will be different than routes that are normally used. That's because the need for these kinds of drugs need to take effect very quickly throughout the body. And most routes that are given result in too slow of an absorption rate of the drug to produce any therapeutic effect. So in an emergency situation, you need to have the drugs administered quickly and absorbed systemically quickly. And by far the most common route of administering an emergency drug would be through an intravenous route. And drugs are injected by either an IV line or with an IV push or with a bolus. Now the intravenous route produces the maximum drug effect in the shortest amount of time. That's why this is by far the most common type of a route to administer any emergency drug. Then once the patient has been successfully resuscitated, after that point an IV drip infusion is used. Another route of administration for an emergency drug will be the endotracheal route. This is where drugs are placed within an endotracheal tube. And as the drugs are mechanically ventilated, the drug solution is propelled into the lungs and absorbed into the alveoli, the air sacs within the lungs. At this point, it's able to be absorbed very quickly and enters the bloodstream very quickly. In choosing this route, therapeutic systemic drugs can be achieved, but only certain drugs can be administered by this route. Not every drug can use this method. In this image, we have someone who has already been intubated, and you can see here in the syringe a drug is about to be administered through the endotracheal tube. And this tubing will go down through the trachea, down into the lungs, where this medication here will be absorbed quickly into the bloodstream. Now, as I mentioned, there's only a certain number of drugs that can be administered through an endotracheal tube, and they have a acronym that's used to describe which drugs this applies to. And the acronym that's used is NAVEL, N-A-V-E-L. So it's this acronym that helps people to remember what drugs are able to be used on an endotracheal tube for an adult. Here are the drugs that those letters represent. N for naloxone, also known as Narcan. A is atropine. V, vasopressin. E, epinephrine, more commonly known as adrenaline. And L, lidocaine, also known as xylocaine. So these are the drugs that are appropriate to be administered with an endotracheal route of administration for an adult. But when it comes to a pediatric patient, that has to change slightly. Instead of the acronym NAVEL, the acronym LEAN, L-E-A-N, is used. So L represents lidocaine, E, epinephrine, A, atropine, naloxone. So vasopressin is not appropriate to be given through an endotracheal tube to a pediatric patient. So another route of administration for an emergency drug is the intracardiac route. Now, this is not frequently used, but can be valuable when other routes have failed to produce any therapeutic effect. And the reason why this is not used frequently, the placement of the site where it's administered has to be placed in a very particular spot. If it's not properly placed within the left ventricle, there's a very high risk of creating a pneumothorax, or cardiac tamponade, or coronary artery laceration. And if you need to use this route, only epinephrine and calcium chloride can be given through this method. Now, the American Heart Association's Advanced Cardiac Life Support Guidelines recommend that this route of administration, the intracardiac injection, only be done in a hospital setting because the route carries such a high risk of cardiac tamponade, pneumothorax, or coronary artery laceration if not done correctly. So this is not something that you're going to be able to do, or you should try to do at home or at work. It's something that should only be done in a clinical setting. All right, now we'll talk about drugs for emergency resuscitation. See, when it comes to emergency drugs, these are used to correct a life-threatening cardiac arrhythmia, in which the heart is either beating extremely fast or extremely slow, or has stopped completely, also known as asystole. These can also be used to increase extremely low blood pressure. Now, depending on what type of arrhythmia the patient is experiencing, that will determine what drug would be used. In a situation of VFib, ventricular fibrillation, you could use the drug lidocaine. This is indicated for the management of a life-threatening ventricular fibrillation condition. So this is the main drug of choice for a patient who's undergoing this situation. And the way it works is it will inhibit the flow of sodium into the myocardial cell. So this also acts to help slow the electrical impulses that causes the heart to fibrillate. So it helps the heart basically to settle itself down and get back to a normal sinus rhythm. But lidocaine has no therapeutic effect when the heart has already stopped. If it's already in asystole, it can't do anything with the heart at that point. It's only given when there's fibrillation. Okay, another drug that could be used during a VFib is epinephrine. So both of these drugs would have the same therapeutic actions to settle down the ventricular fibrillation and get back to a normal sinus rhythm. Another condition that could be addressed is bradycardia. Bradycardia is having an extremely low heart rate, and a drug you could use to treat this condition would be atropine. And the way atropine would work is it blocks the actions of acetylcholine that's released from the vagus nerve. And the vagus nerve innervates the heart, and then when acetylcholine is released from the parasympathetic nervous system, it actually slows the heart rate down. So by blocking the action of acetylcholine, you are preventing it from getting any lower than it already is. So atropine is used to specifically treat severe bradycardia or bradyarrhythmias such as heart block. Another condition that could be addressed is asystole. This is where there is no heartbeat at all, and the drug you would use to treat this condition is epinephrine, also known as adrenaline. Now this acts as a neurotransmitter that's released by the sympathetic nervous system in response to pain or danger or stress. So it makes the myocardium much more responsive to the use of a defibrillator, which can reset the normal sinus rhythm of the heart. And during asystole, it can actually help stimulate the contractions of the myocardium. So epinephrine actually will stimulate the heart to beat, which helps to maintain blood pressure and blood flow to the heart and to the brain. And of course, both of which will improve chances of a successful resuscitative effort. All right, in this image we have an ampule of epinephrine. And like all ampules, once the neck is broken and the drug is able to be dispensed, it can't be preserved. It has to be either used completely or dispensed of. You can't just put that back on the shelf. See some other drugs that are used for life-threatening cardiac arrhythmias. An asystole, calcium chloride. This acts by stimulating the myocardium to contract more forcefully. And this may even stimulate a contraction when the heart has stopped beating and has failed to respond to epinephrine. All right, now we'll talk a little bit more in depth about epinephrine. So in the body, epinephrine acts as a hormone and as a neurotransmitter. It is produced by the medulla region of the adrenal gland, and is also a neurotransmitter of the sympathetic nervous system. Now, epinephrine has the following effects: the stimulation of alpha receptors to constrict the peripheral blood vessels and to raise blood pressure. It also stimulates the beta-1 receptors in the heart to increase the heart rate and cardiac output. It also stimulates beta-2 receptors in the lung to relax the smooth muscle around bronchioles, which will dilate the bronchioles and increase airflow to the lungs. Some other drugs that could be used for emergency resuscitation are vasopressor drugs, and these act by stimulating the beta-1 receptors to increase the heart rate. They also act by stimulating alpha receptors in the blood vessels to produce vasoconstriction and to raise blood pressure. And they also maintain blood flow to the kidneys so that the kidney ischemia from hypotension does not later result in renal failure. See some examples of vasopressor drugs: dopamine, epinephrine, isoproterenol, also known as Isaprel, norepinephrine, also sold under the trade name Levophed, and phenylephrine, sold under the trade name Neosynephrine. Right, now we'll talk about drugs that are used to treat metabolic acidosis. Now, during a cardiac or respiratory arrest, several things will happen. The pH of the blood will decrease rapidly. Carbon dioxide and waste products accumulate within the blood. And in the environment of severe acidosis, the effectiveness of an emergency drug is greatly diminished. An example of a drug that could be used in this condition is sodium bicarbonate. And there is some controversy on how effective this drug truly is. It may actually increase acidosis through a chemical reaction that releases more carbon dioxide in the blood. Now, the American Heart Association guidelines recommend only using this after other measures have failed. Another drug that could be used in metabolic acidosis, tromethamine, also known by the trade name THAM. And this works to correct the acidosis because it buffers the excess hydrogen ions. So this will help return blood pH to within the normal range. Alright, now let's talk about the drugs that are used to treat a drug overdose or a suicide attempt or an accidental poisoning. Now, any drug or substance, if ingested in a very large amount, can be toxic or even fatal. And there are multiple ways to treat this type of condition. One treatment is an emetic drug, which would induce vomiting. This helps to remove the drug from the stomach. Another form of treatment would be administering an adsorbent drug. This will bind to the ingested drug to another substance to make it inert. Another drug that could be given are antagonist drugs, and these work by inactivating the drug within the blood. All right, we'll talk about emetic drugs first. An example of an emetic would be ipecac syrup. This is a drug that induces vomiting. This is only successful if the patient is conscious and will not aspirate the vomited stomach contents. And using this kind of drug is not helpful if the overdose drug has already been absorbed by the stomach and into the blood. When it comes to adsorbent drugs, these are drugs that bind the ingested drug to a substance so it cannot be absorbed from the stomach into the blood. Now, this method of treatment is not effective if the overdose drug or the toxic substance has already been absorbed into the blood. An example of an adsorbent drug would be activated charcoal. And this is administered orally to patients who are still conscious. It can also be given to patients through a nasogastric tube if they are unconscious. When it comes to antagonist drugs, it will vary depending on what type of drug was ingested or what is causing the poisoning. For a narcotic drug antagonist, this would be given intravenously. The drug acts by competing for the same receptor sites as the drug. So by doing so, it will block the receptors, therefore decreasing the drug's effect. Some examples of this kind of drug would be nalmefene, also known as the brand name Revex, and naloxone, also known as Narcan. When it comes to anti-anxiety drug antagonists, these would be classified as the benzodiazepine types of drugs. And these work in a similar way. They compete for the same receptor sites, and by doing so, they block the receptors of the drug that's ingested, so it will decrease the anti-anxiety drug's effects. An example of this kind of drug would be flumazenil, also known by the trade name Romazicon. When it comes to antidepressant drug antagonists, these are the tricyclic type antidepressants. That's a reference to their chemical structure. These compete for the same receptor sites as the antidepressant that was ingested, and therefore they block the receptors, so it's going to decrease that drug's effect. An example of this kind of drug would be physostigmine, as is sold under the trade name Antilirium. The other drugs that are used for drug overdoses, the digoxin immune fab, also known by the trade names Digifab or Digibind. It is not uncommon for patients who are older or who have a decreased kidney function to experience digoxin toxicity because of the long half-life of the drug and because of the low therapeutic index. Acetylcysteine, also known by the trade name Acetadote, and this is used to treat acetaminophen overdoses. It's basically overdoses of the drug Tylenol, and this helps to protect the liver. It's another drug that could be given for a drug overdose, fomepizole, also known by its trade name Antizol, and this is given for ethylene glycol and methanol poisonings, which are antifreeze and wood alcohol poisonings. Some other examples of drugs for treating drug overdoses. Now, these drugs would treat lead or mercury or arsenic, gold, iron, or aluminum toxicity. The ferrocirox, sold under the trade name Exjade. The ferroxamine, also known by its trade name Desferol. Dimercaprol, also known by its trade name Balan oil, Editate calcium disodium, also known by the name calcium disodium versinate, Susamer, which is known by its trade name Shamet. Alright, now we'll talk about drugs that are used to treat anaphylaxis. Now, in anaphylaxis, there's a massive amount of histamine that's released, causing two life-threatening conditions. There is severe vasodilation, which causes a very dramatic drop in blood pressure and also shock. And there is bronchoconstriction, which will severely limit the airflow both in and out of the lungs. The drugs used to treat anaphylaxis is epinephrine, also known as adrenaline, and the main drug that's found in an EpiPen. That's why it's called EpiPen. And this acts to constrict the blood vessels to restore normal blood pressure, and also to relax the smooth bronchial muscles, allow for adequate airflow. Alright, this image we have an example of an EpiPen. Again, it looks similar to a normal pen that you would write with. It has a dose of epinephrine inside it. So for those people who have severe allergies, whether it be to insect stings or peanuts or shellfish, any severe allergy, need to carry something like this with them at all times. Okay, now we'll talk about intravenous fluids. Now, in an emergency, IV fluids are used to administer drugs. They're used to correct a decreased volume of body fluid. They're used to correct a decreased level of electrolytes or decreased levels of glucose. It's used to administer blood or plasma products, and also given to maintain venous access between drug doses. Now we'll talk a little bit more in depth about an IV fluid. Glucose, which is a simple sugar, is the only form of a carbohydrate that cells can use as a source of energy. Now, IV fluids contain a glucose-type sugar known as dextrose. Now, dextrose has the same chemical structure as glucose, but the molecule is rotated in the right-hand direction. That's why it has the prefix dextro. But when it comes to the action of dextrose within the body, it is identical to that of glucose. Electrolytes are chemical elements in the blood and inside cells that have either a positive or negative electrical charge. And some common electrolytes that are used in IV fluids include sodium ions and chloride ions. When it comes to dextrose intravenous fluids, there are different amounts of concentrations of dextrose with water that are given. You can have dextrose 2.5% in water. You can have dextrose 5% in water, and that's indicated by the abbreviation D5W. You can also have dextrose 10 in water, or D10W. So 10% of dextrose in water. Those are what those letters and number indicate. You can also find this in concentrations of 20%, 25%, 30, 40, 50, 60, and 70. Now, dextrose IV fluids can also be administered as a bolus injection through an already existing IV line. This can be given to patients with low blood sugars, patients who are diabetic, or premature infants. When it comes to sodium IV fluids, if a patient does not need dextrose, an IV infusion of just sodium, chloride, and water can be administered. And sodium is an important electrolyte in both the intracellular fluid and the extracellular fluid of the body. Now, intravenous fluids contain these electrolytes in proportions that parallel those found within tissue fluids. The concentration of the fluid is known as the physiologic salt solution, or normal saline, which is indicated by the letters NS. Now, sometimes an IV fluid is half the normal saline is ordered. This is written as 0.45% sodium chloride. In this image, we have examples of IV fluids of both normal saline and half normal saline. See the bag here on the left, 0.9% sodium chloride. That would be the normal saline dose. And the bag over here, 0.45%. That would be half normal saline. Alright, now we'll talk about combination IV fluids. Now, depending on the needs of the patient, sometimes you'll see intravenous fluids given in various combinations with one another. You'll find dextrose in varying concentrations and normal saline or half normal saline combined in a single IV fluid. Some examples would be dextrose at 5% and normal saline, and that would be indicated by this, D5 for dextrose 5% and at 0.9% sodium chloride. That would be the normal concentration of sodium chloride. We're going to have dextrose 5% and half normal saline, which would be indicated by D5 for dextrose 5% and 0.45% sodium chloride, half the normal concentration. And continues on throughout the various concentrations of dextrose. Dextrose 10% normal saline would be D10 and 0.9% sodium chloride. Dextrose 10% at half normal saline, D10/0.9% 0.45% sodium chloride. Another combination IV fluid that you could find is dextrose at 5% in lactated ringers. So that'd be indicated D5/LR. This contains a fixed amount of dextrose and water with sodium and potassium, calcium, chloride, and lactate. And this combination was named for the English physiologist Sidney Ringer. See, another type of combination IV fluid is called a crystalloid. This is a general category that refers to any IV fluid that provides dextrose and sodium chloride alone or in combination with other electrolytes. Another type of IV fluid you may find are TPNs, total parenteral nutrition. And this is a combination of dextrose and electrolyte IV fluids. And these are given to maintain fluid and electrolyte balance within the patient. And they're also given to supply calories to the patient because they are unable to completely meet the long-term nutritional needs that they need. And these fluids specifically lack protein and fat and vitamins. It's just a combination of dextrose and electrolytes. So this is a specially prepared IV fluid, and it's designed for patients whose nutritional needs can't be met with just regular dextrose and electrolyte fluids alone. And this type of IV fluid contains very specific amounts of essential amino acids, electrolytes, vitamins, and minerals. These will be individually tailored to the patient's need according to the physician's order. Now, this type of solution is also known as a hyperalimentation solution, and this must be administered through a special long-term IV catheter that's inserted into the subclavian vein or in the superior vena cava. And the catheter can either be a Hickman or a Broviac catheter. Another type of IV fluid that can be administered are intravenous lipids. And these are given to meet a patient's dietary fat requirements. So you may have a separate intravenous solution of just lipids that may be ordered. And a solution of IV lipids will contain fat in the form of soybean or safflower oil, water, glycerin, and egg yolk. And when it comes to lipid fats, these will be a more concentrated source of calories than dextrose. And fats contain about 30% more calories per gram than dextrose. These will also contain essential fatty acids. And these are only given to patients who are unable to take oral feedings for an extended amount of time. And some examples of lipid fats that could be given in this form will be intralipid or lipicin. So another type of IV fluid that could be given are intravenous multivitamins. These are specially formulated combination of 12 vitamins for IV administration. And these will contain 9 water-soluble vitamins and 3 fat-soluble vitamins. And there are actually 4 fat-soluble vitamins, but the 4th is not given intravenously, which is vitamin K. And some examples of an IV multivitamin fluid that could be given: Baroka Parenteral Nutrition, Infuvite, and MVI-12, which is just an abbreviation for multivitamin infusion 12 in reference to the 12 vitamins that are given. Alright, now we'll talk about blood and blood products. Blood for transfusion is available as either units of whole blood, packed red blood cells, or platelets. When it comes to whole blood citrated, this contains all cellular components of blood, so red blood cells, white blood cells, and platelets. It also contains all the plasma and all of its constituents, so albumin, globulins, clotting factors, electrolytes. And the term citrated refers to the anticoagulant citrate that's commonly used to preserve whole blood, which helps it last longer when it is refrigerated. The whole blood will provide a complete correction of blood loss and blood cells and plasma in the correct proportions. Now, before whole blood can be given as a transfusion, the patient and the unit of blood must be typed, the correct blood type, and also cross-matched to each other. Now, both of those assures compatibility, and this will avoid transfusion reaction. If someone is given the wrong blood type, you end up having a hemolysis of red blood cells due to the incompatibility. Alright, now we'll talk about packed red blood cells, or PRBCs. This is a concentrated preparation of red blood cells in a small amount of plasma that have an advantage over whole blood. These can be given without causing fluid overload to a patient. This is of special importance to patients with congestive heart failure and also premature infants who cannot tolerate any increase in blood volume. Now, the downside about packed red blood cells is they do not contain plasma proteins or any clotting factor. But just like with whole blood, they must be typed and cross-matched before being administered to a patient. The other component of blood are the platelets, and these are extracted from the whole blood. And these are suspended in a small amount of plasma, and these would be cross-matched for the best results. Now, these can also be given in an unmatched form, especially in an emergency situation. And these can be given unmatched because they won't provoke a transfusion reaction by the body. The patient's antibodies will quickly destroy them, but these will be less effective in general compared to platelets that are matched. Now, platelets would be given to patients to have thrombocytopenia, which is having a decreased level of thrombocytes or platelets within the blood, the patients who have leukemia, or who have suppressed bone marrow. All right, now we'll talk about plasma and plasma volume expanders. Now, these do not contain blood cells. And these are derived from whole blood that has undergone plasmapheresis to remove the blood cells. And these can't raise the patient's hematocrit level to contribute to oxygen carrying capacity. So when it comes to plasma, this has an advantage over blood because it does not have to be typed or cross-matched. The plasma can be given to hemophiliacs who need the clotting factors, or to patients with severe burns to restore blood volume and electrolytes. A form of plasma that can be given is fresh frozen plasma. This consists of plasma that contains all of the plasma proteins and clotting factors, and it's frozen to prolong its shelf life. Then it is thawed at room temperature before being administered intravenously. Another type of plasma can be given, plasma protein fraction. This is derived from plasma, and this will contain 5% plasma proteins, the most of which will be albumin, mixed with normal saline. But this solution has no clotting factors. And some examples of this type of solution would be plasminate proteinate. A product that's found in plasma will be albumin. Albumin is derived from plasma. This contains only the plasma protein albumin, and it will not contain any clotting factors. Albumin is prepared in either a 5% solution or a 25% solution. And the 5% solution is what will approximate the concentration that is found within blood. And some examples of this kind of fluid that could be given to a patient will be albuminar or plasbumin. Another type of solution that could be given, cryoprecipitate. This is a plasma extract that's prepared by freezing and then slowly thawing the plasma. And this will contain concentrated amounts of factor VIII, von Willebrand factor, and also fibrinogen. This is used to treat patients with hemophilia or von Willebrand disease. All right, now we'll talk about a focus on healthcare. Now, each lot of clotting factor is made from the pooled plasma of 15,000 to 60,000 donors. And there are never enough volunteer donors, so companies will often pay plasma donors. And the process of blood donation and then separation of the blood cells from the plasma and then the return of blood cells to the donor is called plasmapheresis. Plasma, albumin, and cryoprecipitate are all prepared from pooled units of blood plasma. And these are tested for hepatitis and HIV, and then heat treated for 10 hours to reduce the risk of transmitting any diseases. However, these precautions are not totally effective in eliminating the viruses, especially HIV. And because of this, many hemophiliacs who were treated with clotting factors in the past developed hepatitis and AIDS. All donated blood is tested for syphilis, hepatitis, and HIV according to guidelines established by the FDA, the federal organization that is responsible for the safety of blood and blood products in the U.S. The FDA has banned blood donated by people who have lived in or visited Europe for a certain length of time because of the possibility of contamination with the microorganism that causes mad cow disease and a fatal neurological disease in humans. Although the United States has the safest blood supply in the world, there's still a small risk of transfused blood being contaminated with either hepatitis or with HIV. All right, now I'll talk about plasma volume expanders. These are manufactured from complex carbohydrates and also normal saline. Now, these do not need to be refrigerated, and these can retain their potency for many months. And they also do not need to be typed or cross-matched. And these can be given intravenously to restore blood volume back to normal levels. And some examples of this kind of a solution would include dextran, known by its trade names Macrodex or Rio Macrodex, or also Hetastarch, known by the trade name Hespan. I will end this chapter with a did you know? Dextran consists of synthetic complex carbohydrates with repeating three-dimensional structural units. Now, normal saline is able to enter these three-dimensional structures to form a viscous fluid that can be used as a substitute for plasma. Now, the combination of the bacteria Streptococcus mutans, which is present in your mouth, and sucrose, which is common table sugar, this combination produces dextran. The viscous and sticky dextran biofilm absorbs lactic acid produced by other bacteria in the mouth and holds it in contact with the teeth, producing teeth decay. Hetastarch is derived from a waxy starch commonly found in potatoes, wheat, and also corn. When head of starch is mixed with normal saline and administered intravenously, it forms a solution similar in viscosity to normal plasma. Okay, that brings us to the end of this chapter and also to the end of our video series on pharmacology for health professionals. I hope you've enjoyed watching these videos. I hope you feel that you've learned something, and thank you for watching.